Hola, buenos días, familia. Soy María Baños Jordán, la presidenta de Texas Familias Council. Good afternoon, everyone. I'm Maria Baños Jordan, president of Texas Familias Council, and I'm honored and blessed today to have a friend and a colleague, Dr. Alexis Cruz from Lone Star Family Health Center. How are you doing, Dr. Cruz?
I'm great. I'm so happy to be here.
Well, you've been so gracious for the past, I guess, year and a half in talking to us and kind of guiding us through some of what you've seen through the pandemic. And as we were just talking earlier, I feel like we're shifting. Now we're in May 2023, and we've had 3 years of working through many different variants and many different effects and unknowns. And as we were saying, cases have dropped as far as the amount of cases and transmission rate, but we are still seeing COVID-19, and we certainly are still seeing a multitude of public health issues in our community. So I really wanted to invite you back to kind of share with us what you're seeing, your concerns, what you would like our families to focus on, especially going into the summer months. Y estoy preguntándole a la doctora, pidiéndole que comparte sus observaciones de lo que ha visto estos años con la pandemia de COVID-19, porque ya hemos pasado por varias variedades de la pandemia. Pero seguimos con muchos problemas de salud pública que requieren nuestro enfoque. Y ya como vamos a entrar ahorita en el tiempo de verano, donde las familias están en casa más y están viajando, compartiendo, es una buena oportunidad de enfocarnos en nuestra salud, como siempre, porque la salud es lo central, ¿verdad? Del bienestar de la familia. And so, yeah, so anyway, so I think you've been busy since the last time we've spoken on this program is taking care of I guess, several different public health things that have come your way.
Yes, very busy. Certainly I'm still seeing a lot of COVID that is not left, but of course there's so much that we see, in our clinics and in the hospital. I will say things that have come up that we can talk about throughout our session. Alcoholism has come up a lot in the hospital. I think it's something about the springtime. I don't know what happens, but we're seeing more and more cases of withdrawals from people who have alcoholism problems. Mental health is something I'd love to talk about with you, both in adults and adolescents. And then, of course, annual exams. We're at that stage. We are past the new year. Everybody's getting letters in the mail to come make sure you do your annual exam. Estaba diciendo que más de todo todavía estoy viendo COVID en nuestras clínicas y también la influenza, pero hay otros tópicos que quiero hablar sobre. Problemas con bebando alcohol demasiado, salud mental también, y luego exámenes de bienestar.
Sí, ahorita muchos de nosotros, pues por el estrés de la pandemia y pues la vida, ¿verdad? No cumplimos con nuestros exámenes anuales. Yo soy culpable que tuve que este año pasado volver a mis médicos y volver a tomar los exámenes que necesitaba para asegurar que ando más o menos bien. So yeah, I know a lot of us gotten behind on our annual checkups, and we've had to reestablish those connections with our doctors and, get our exams done and make sure we're doing okay. It's been tricky, right? Sometimes especially women, we're taking care of the family, the community, and then we say, oh, I can just push myself a little bit more, until we realize we're having issues ourselves.
Yes, absolutely. I think everyone should see their doctor at least once a year. Just come in, say hi, do blood work, get your vaccines updated, and talk to us, right? A once a year visit is a great opportunity to touch base. Did something new happen in your life? Was a family member diagnosed with something that now your primary doctor needs to be aware of?
That's a
because
good
it can
point.
increase your risk. And then of course see us more frequently if you have concerns. But I really want people to understand that you can see us even if you're feeling great. There's a whole lot we can do even if you're feeling great.
You're right. You're right. Absolutely. I mean, I think, and especially the lessons of this pandemic has one of them has been to really understand the value of our health, how vulnerable it is, but also how much power we do have in our own hands to be proactive and to be more mindful of, how we eat and how we spend our time and our stress levels. So I think you're right. I think touching base with your primary care doctor at least once a year, just to kind of touch base and share and maybe hear back things that you didn't think about.
Yeah, absolutely. I mean, I'm right there with you, as I might be a doctor, but once a year I have to sit on the patient side and go see my doctor. And it is always nice to be reminded that I have to watch what I eat and I have to exercise just the same way I would tell my patients to do.
So you have been part of a wonderful group at Lone Star that has come out to some of our communities and done some amazing public health outreach these last few years, and we are so thankful for that. And Dr. Pamela Ferry actually joined us a few weeks ago, and it was wonderful because she had received our Iscalia Award last year with y'all's residency group. And this year she was there that helped me present it to the Deerwood Community Center. They were our honorees this year. So it was kind of like the teacher passing it on to the students.
Exactly.
And they were so proud, and it's been a wonderful thing to witness this nurturing really between physicians and the community welcoming you, and also not just coming to the workshops, but it's changing, I think, the culture a little bit of how they're focusing their efforts. And so that is amazing to kind of watch that kind of develop and penetrate the elders and the young. And so thank you for having been part of this.
Oh, of course. And I think that it's something that, the community outreach and the public health outreach has definitely changed the way that I practice. It's a wonderful learning environment for anyone to be a part of, because you're working with patients who face different barriers. You have to be thinking about that as you take care of the patient. And it gives me fulfillment, I think. I like to tell my family that I have to keep going to Deerwood and I have to be part of the underserved track, because it's like this monthly boost of remember why you're doing this, remember why you went into 11 years of school and training. So that's really wonderful. And I agree with you. I think us meeting our patients where we are, being a part of the community, is breaking down the stigma of going to the doctor. I can't tell you how many times I've, gone into a patient room and they light up to be treated by a Latina who speaks their language. And then they're like, you know what? My husband actually needs an appointment. Or, you know what? My son needs an appointment. And it's like, yes, let's remember that it's not a scary thing to go to the doctor, and we need to all be checked in on.
Absolutely. Le estaba diciendo a la doctora que agradezco mucho el esfuerzo que ella y los otros doctores de la clínica han hecho estos años. Han venido con la doctora Pamela Ferry a la comunidad de Deerwood, que está cerca de Conroe. Ya llevan, creo que casi 2 años viniendo con diferentes programas de salud, y han creado una cultura nueva que se enfoca en la salud pública, la salud familiar. Y que eso verdaderamente tiene un gran impacto, no solamente en esa comunidad, pero también en ellos como doctores que están viendo pacientes en la clínica. Ya hace unas semanas, la doctora que había recibido un honor de nuestro concilio el año pasado, ella estuvo presente para presentar ese mismo premio, reconocimiento a la comunidad de Deerwood. Entonces, para mí fue algo muy bello ver que los estudiantes ahora están recibiendo el reconocimiento también por los esfuerzos que se han desarrollado. Y sí, eso creo que ha sido una lección de la pandemia, que una comunidad verdaderamente depende en cada uno, ¿verdad? Cada uno estamos haciendo nuestro pedacito Y no es que uno sea más importante que el otro, pero entre todos estamos tratando de llegar a una comunidad más sana, más rellena de lo bonito de la vida y de la potencia de nuestras familias. So, muchísimas gracias, doctora. Estábamos hablando un poquito antes de el cambio que hemos visto con COVID específicamente. Ahorita estamos donde ya creo que la CDC ha cambiado el requisito de las vacunas. So I think the CDC has just changed some of the requirements for the vaccine, the bivalent vaccine. So would you mind talking a little bit about that as far as what people should expect going forward?
Claro, antes teníamos diferentes vacunas contra COVID, fue el Pfizer, el Moderna, todo eso. Y antes fue que necesitabas 2 dosis de una vacuna de un tipo y luego un booster del bivalent, ¿ok? Ahora estamos diciendo que cada persona mayor de 6 meses necesita una vacuna que es el bivalent, ¿ok? Es diferente tipo. Y no importa si te tocó Moderna, si te tocó Pfizer antes. Cada persona necesita una dosis de nueva vacuna. Si tienes mayor de 65 años o tienes una enfermedad médica crónica, es probable que vas a necesitar 2 dosis de ese segundo vacuna. Y esos pueden ser cada 6 meses. ¿Ok? Pero todo depende y es necesario hablar con su doctor. So I was just saying that it used to be that you could get the Moderna, you could get the Pfizer, you know, it was just whatever was on the market. And then on top of that, you would get the booster in order to be recognized as fully vaccinated. We are now recommending that everybody just get the bivalent. Okay. And everyone needs it, you know, and this is safe for children as well. And if you have any concerns, talk to your doctor. You know, if you're immunocompromised or you're not sure if you should get the vaccine, it's always worth just having a conversation. If you are 65 and older, you're going to need 2 doses of the booster. And those they're not at the same time. So you're going to need to remember to come back to your doctor. That is a hard thing. And I think it's easy to forget sometimes. And then of course, if you have a chronic medical condition that makes you immunocompromised, you're going to need 2 doses as well. And that could be something as simple as diabetes, hypertension. That can make you immunocompromised. Now, estaba diciendo que tipos de enfermedades crónicas en que necesitas 2 dosis del vacuna pueden ser diabetes, alta presión, obesidad. No son que esas enfermedades son raros, son muy comunes. Y unos no piensan que necesitan la segunda vacuna o la vacuna nueva con solo estos enfermedades. I think it's easy for people to realize, or to not realize rather, that they fall into an immunocompromised category.
Right.
Because it's so common, right? It's almost like everyone in your family might have diabetes. Sure. Everyone might be taking a blood pressure medicine, and you don't think it's anything to be too terribly concerned about, but you do fall into a higher risk category.
Right. And the virus is still, you know, quite strong, even though, you know, we've 3 years into it and there's been different variants. I mean, you're right. If you are vulnerable, then you could take a turn. And so that booster certainly is important. So the bivalent booster definitely, if you haven't gone out and taken it, and right now would be a great time, right before summer when everybody's traveling.
Right now would be a great time because everyone is about to go out. Yeah. You're about to be in crowds of people for 4th of July shows, Memorial Day parades, all that good stuff is going to be full of crowds. So now is a great time, especially if you're thinking about doing something big, like going to Disney World, going to Six Flags, something where you know you're going to be surrounded by crowds. The week before or 2 weeks before, just make it a point to visit your doctor. And you and I were just talking about it. I got COVID recently. COVID does not discriminate. And I should have gotten my booster a lot sooner. And I had a booster a year ago, which did help. I didn't feel any symptoms when I got it last year, but I didn't get it this year. and I should have, because it was rough. You know, I had really bad fevers. Now, thankfully, I wasn't hospitalized. But if I had lung problems, if I had
Right.
diabetes, high blood pressure, that could have put me in the hospital, you know. So
Sure.
it's important to remember that it's still around.
Yeah, and I think that that's the difficult thing is this whole thing was so different and so new to all of us who had not gone through a pandemic, obviously in 100 years
Right.
at this level. This coming out, I say coming out because we still have it, but we are advancing through the natural cycle, I guess, of this pandemic. But it doesn't mean it's eradicated. It is still here. And like you said, some of us are more vulnerable and can become more vulnerable. And so we have to be mindful of that booster shot. And right now, so I think other than those with these underlying conditions and 65 and older, right now it would just be once a year to take that booster.
I think that's where the CDC is heading, is essentially making it like a flu shot.
Okay.
Now, the question that I don't know that I've gotten this answer from the CDC, and I don't know if they're working on it, is when is the best time, right? Because flu, we have a flu season.
Yes.
You know, October hits and your doctor starts reminding you to get it, you know. Do we have a COVID season? I'm not sure because I feel like I always see it in my clinic.
Yeah, yeah.
It comes in waves, I will say. So after spring break, when everyone got together for Easter and all that good stuff, we saw a big wave. You know, after Christmas, we saw a big wave. After Thanksgiving. So I'm not sure when would be the best time, but I do think they're leaning towards making it a yearly shot, just like the flu shot.
Sí, entonces es importante, si no ha tomado esa vacuna de refuerzo, de ir ahorita antes del verano, antes que se junten con mucha gente, para que ya tengan esa protección extra. Y por ahorita sí se recomienda para personas mayores de 60 años o con enfermedades que se tomen esa segunda dosis del refuerzo. Pero si no ha tomado el refuerzo ya en varios meses, tal vez es buen tiempo ahorita antes de verano.
Claro, y estamos diciendo que, pues, pensamos que va a ser una vacuna que toman cada año,
Sí.
pero es pregunta de cuándo. ¿Cuándo es el mejor tiempo? Porque estamos viendo que no hay una temporada de COVID, como la temporada de influenza o el resfriado, pero estamos viendo que después de holidays, you know, después de eventos grandes o vacaciones, vemos más casos, especialmente en los niños.
Seguro, seguro. Sí, y ahorita, por ejemplo, mi mamá que tiene 86 años, ya le toca esa bivalent, porque sí la había tomado en el otoño, pero ya es buena idea ahorita que tome la segunda dosis del nuevo bivalent. So, doctora, con el COVID que ha impactado tantas vidas, ahorita, ¿cómo mira usted el impacto después en sus pacientes? O sea, ¿se han estado recuperando? ¿Siguen con long COVID? ¿O ha mirado que tal vez ciertos aspectos de la salud están más delicadas que antes? ¿Qué es lo que ha visto algún cambio?
Sí, la mayoría de mis pacientes se curan bien y no tienen síntomas de long COVID. Pero hay ciertos pacientes que sí les tocan más peor. Tengo pacientes que antes de COVID tenían prediabetes o un poco subido su nivel de azúcar, pero no como diabetes. Les tocó COVID y luego ya tienen diabetes como con niveles de azúcar muy altos. So, you know, I've had cases in which somebody goes from pre-diabetic or maybe just a little bit elevated blood sugar, they get COVID, and all of a sudden it's like I'm looking at the labs of a person who's had diabetes for 10 years and it's uncontrolled. And it causes issues, right? Because if you weren't even aware of it, you're not going to be aware to go to the doctor, right? So a lot of these cases we're catching in the hospital when things are a little too late. Thankfully, everybody does well, but it goes back to the fact that for some individuals who are predisposed to autoimmune issues, COVID can unmask that. En ciertas personas que tienen más riesgo de tener enfermedades como autoanticuerpos, ¿ok? Como el rheumatoid arthritis, así, o el psoriasis. Si tienes más riesgo de eso, es una posibilidad, no necesariamente probable, pero una posibilidad que después de que te toca COVID, te puede tocar otra enfermedad.
So, sí, en unos casos se está desarrollando estas otras enfermedades más fácilmente. Si han tenido alguna historia de estas enfermedades. So, sí, o sea, estamos aprendiendo todavía, ¿verdad? De
Yeah.
impacto.
Oh, yeah, for sure.
Um, ¿Qué es lo que ahorita está usted recomendando a sus pacientes en general, no solamente con COVID, pero en general, que para tratar su salud, para manejar su salud, what are you recommending people focus on now to regain their health or just to be healthy in general?
I think it's got to be diet and exercise all the way, right? And I don't think I ever stopped recommending that, but we're entering summer. The CDC emergency is gone. You know, I think life is getting a little bit back to normal. This would be a great time for people who have been putting off some of their goals to then put them back at their forefront. You know, do you have goals to get back to, you know, where you were mentally or physically before COVID? Now would be the time, you know. And then I do think I am stressing a lot of more mental health as well, because the being isolated in the pandemic, you know, not knowing how things were going to go. And I mean, we've been hit with so many things at once. You know, it's the COVID pandemic, then it's a recession. We were almost in a recession. We might still be on our way towards a recession in the United States. The number of mass shootings we've seen in this country. We just had one, you know, yesterday in Allen, Texas. They're all over. And so I think focusing on our mental health now is where we need to go.
I completely agree. I was sharing with Dr. Cruz that, you know, I spent a couple hours the other day at one of the local high schools talking to teenagers, and just the level of need and concern with mental health. It was really, not that it surprised me, but it's heartbreaking, I guess, to see that children do feel like they're trying to manage it all on their own. You know, where are their support systems? Are we as adults listening correctly? Are we focusing enough of our time?
Right.
So hablando con jóvenes en la escuela el otro día, pues sí, no fue sorpresa, pero sí me quiebra el corazón escuchar que los chamacos están batallando con salud mental, con ese sentido que están solos o que no tienen ese apoyo comunitario. For our council, that's always been such a big part of our mission. And of course, the pandemic brought it even more to the forefront. The importance of creating safety nets in communities, of like what you guys are doing with the outreach component of your practice is, you know, getting to know the community firsthand, developing trusting relationships, you know, being a support system, a friendly face, a loving presence in the community, so that people feel like there is, you know, someone is watching or caring or there in case they need it. I mean, I think we underestimate the power of that. Y sí, es tan importante estas conexiones en las comunidades, que tengamos esa conexión directa con uno con otro y con las organizaciones de salud, tan importante.
Yes, it is. And I think that is all that anyone can do, is just be approachable, be that friendly face, be somebody that people can come up to you and talk about their concerns or what they're going through. That would make the world of a difference. It could make a big difference in somebody's life. And I hope that that's what we're doing, right? As physicians in the community, that we're being approachable. And I would urge everyone to, this summer, just take some time. You know, if you have the time off work, if you're going on vacation, if you're spending time with family, to check in mentally with yourself. You know, is there something you want to be doing different this year? the summer is a time for change,
Right. Right. Yes. A little decompression. I think that we could all use a little
Yeah.
breathing room, and, just to kind of be grateful, for our health, for what we do have, but also be looking at what, like you said, what are the pieces that I can change, or that I'm feeling I need to expand or change. Um,
Yes.
is the Now, from a Latino perspective, you mentioned how important it is sometimes, especially for patients or people, to see you, to know that you come from a background that is relevant to them, that they understand that aspects, nuances of our culture, that we all, that are, as much as we're all different, there are these commonalities, right?
Yes.
um,
Yeah.
so, or do you feel like, our Latino community, how do you feel overall and I know you see a variety of patients in the clinic, and of course you're outreaching into some of our Latino communities, but do you feel like they're reaching out? Do you feel like they're getting information, or do you have concerns about what what they're receiving?
I think that they're reaching out to me, to our physicians for sure. I think so. Um, I get concerned that sometimes we reach out too late, that my Latino population reaches out too late, or that I think there's a habit to only see the doctor when we're sick.
Yeah.
Now, I am seeing that my younger Latinas, and I say Latinas because it is mainly the women that come into the doctor, we're doing better about seeing the doctor even when everything's okay. Now, I think that I'd love for that to stretch out to the husbands and the kids, but it starts with the mother, right? I think we're a very matriarchal society. The grandmas are the queens of the family, and we have multi-generational homes. So if we can get moms and tias and sisters to feel comfortable going into the doctor, even when everything is okay, to get an annual checkup, my hope is that will spread to bringing the kids in for their annual checkup, and encouraging dad or tios to come in for their checkups as well. Something else that I was seeing was I had it at the tip of my tongue. You're gonna have to forgive me for a bit. Gosh, I was seeing something else. I had it.
Well,
You'll
one of
edit.
the things that I was just thinking when you were talking about was, with the multi-generational families. So unfortunately, some of us no longer have a lot of the older, the great aunts and the aunts that helped
Right.
raise us. They've passed on, or some of us are separated by countries, right? Because some of us
Yes.
aren't here with everyone. But it is so important. I was thinking earlier today about all those moments shared in families, and especially in our culture, where with women, especially the customs and traditions we have with one another. And I was remembering that as a little girl, how much time was spent on my hair. Like
Oh yeah.
for some reason that became like the center point. Like, I used to have this very long hair, but everybody had their hands on it. I'd have the abuelita and the tia,
Yeah.
mother, the braiding and the brushing but it was a beautiful tradition of the women gathering and nurturing one another and talking, and this time spent and just sharing. But those are really very nurturing, powerful moments that I think we've taken for granted in our modern life, and especially if we are separated from our families, that we don't have that nurturing. And going back to mental health, is how important that touch and that connection really, really is. Each culture has its own ways of
Right.
expressing that, but I have such beautiful memories of that as a kid, and it, as you get older, you miss that. Like, you do realize that
Yeah.
was a very special piece
Well,
of.
and I think you're touching on something really important in that I don't think moments like that are as common in the new generations, right? I think that cell phones play a role and computers play a role, of course. And I think our family dynamics have changed a little bit, but it's a huge thing that we're missing. One thing I was going to touch on, it came back to me and it plays a role in this. Um, is education for young Latino parents is something that I feel like is lacking. I'd love to get into that a whole lot more. I wish I that would be one of my dreams, is to go out into the community and do early parenting classes and get groups together, because I don't know that we're honest about the difficulties with it as parents. You know, the fact that breastfeeding does not come easy. It is not a natural journey, you know. You don't have to give birth without epidural just because your mom and your tias and your abuelita did, you know, or, you know, they went all natural. Doesn't mean that you have to, and it doesn't make you less of a mom. And knowing what to expect. How often do you feed a baby? You know, how often is it normal? How often should you be waking up in the middle of the night to feed your baby? How do you install a car seat? You know, these are things that I am seeing a lot of young parents in the maternity ward that are of Latino descent, and they don't have those answers. They have a lot of questions, and I feel like they have good support. You know, I see the abuelitas there and the tias come to celebrate once the baby's born, but it's a question of, you know, are we within our families being honest about our struggles?
Yes, yes, I hear what you're saying, and I think I see that also very much true. And actually, the startling numbers of maternal death rates in Texas, even alone, right? Especially women of
So
color.
bad. Yeah.
I mean, there's no reason for that. I mean,
No.
that women should not be struggling to that extent and dying because of that. And I do think that that is related a lot to education and that connection to community. And I think especially women of color being very resilient and sometimes very independent minded, because we do carry so much on our shoulders, sometimes aren't aware that we do need that help, that we do need that nurturing. So yes, I think that those are pieces that I believe in our modern American society, we haven't adequately addressed how that village, you know, connection and nurturing plays a role in the well-being of women and children and the community.
And it's hard because I think that, you know, things like TikTok and Instagram and YouTube, you can learn a lot. Don't get me wrong. You can learn a whole lot from a variety of different people. But it's a double-edged sword. You know, you might be learning a whole lot, but are you gaining those meaningful connections with your family? I don't know that that's, you know, you're losing that.
Yeah.
Whereas, you know, maybe you can do both. Maybe you can go to YouTube to learn about breastfeeding, or, you know, what is life like with a newborn, but at the same time creating that bond with your own mother or the extended women in your family about what are the true difficulties. Because I have a lot of Latina women come through who are like, no epidural, we're going to deliver vaginally, just like my ancestors did, which props to you, amazing, but you don't have to sit through pain. And then they're breastfeed only, but my mom didn't walk me through how to do that, you know. Breastfeed only, but I have no idea how to do it, and everyone just said it would come naturally, and it really doesn't. So I think, anyway, I think that there's a lot of good information out there on the internet, but it's taking away from some of the connections that we're making.
I agree. I mean, and there is no substitute really for that personal connection, the sharing of ideas directly, that, you know, that synergy that happens between people, and working through some of those decision makings, whether it be around, you know, childbirth or breastfeeding or anything that has to do with decisions, you know, about our bodies and our families. We need to have that interaction with one another about that, you know. I mean, I think for the role of the physician, you all oftentimes have to come in and take on that role, because like you said, these women don't have that support system. But yeah, I think that, you know, the piece you touched on with education of young parents and young families, you know, I used to do that I did it for 10 years early in my career, and it was so very rewarding
Oh, I'm sure.
because
Yeah.
it really empowers people at the
Oh,
base
yeah.
root. It really gives them those pieces that they didn't realize they have, and they just didn't know how to use a lot of it. And yes, I think we certainly need to get back to that, you know, basic connection and community. Um, you mentioned a bit ago about the declaration, the pandemic declaration. Actually, it's coming to an end
Right.
this month or this week,
Yes.
which
Yeah.
is going to make some shifts in what's available, I guess, for certain pieces of healthcare to different communities. And so, my understanding, it'll be a slow kind of, you know, adjustment over the next several months, but it does take some of the attention, right, away from the pandemic or the other pieces having to do with our health. So what would you like to see going forward now, that we continue to focus on, continue to prioritize as a community?
I think mindfulness about your health. I feel like having COVID on the news all the time made people aware of their own health. Suddenly there was this emphasis on your symptoms and
Right.
do you have high blood pressure? Do you have diabetes? Do you smoke? It was at the forefront. It was all you saw on the news. And even up until recently, it was still making headlines. Which I think forced people to say health is a priority, right? Americans are talking about this on the news, therefore Americans prioritize health, right? And I think that with COVID no longer being an emergency and things getting back to normal, we're going to see less and less COVID, you know, news segments or articles. And what I would like to see is that we still put an emphasis on our health in our news and in our articles and in our social media, because COVID helped us put that all at the forefront. And I'm afraid that if we lose that, then the news goes back to the regular news cycle, and people stop realizing that health is a priority, and it stops being this reminder to take care of yourself.
Sí, eso lo que le pregunté ahorita a la doctora era que ya que estamos moviendo de este tiempo de crisis declarado por el gobierno, ¿qué es lo que ella le gustaría ver que seguimos enfocados en nuestras comunidades, en qué parte de nuestra salud? Porque sí, ya el énfasis no va a estar en tanto en el COVID como ha estado estos años, pero sigue los riesgos a la salud y seguro que sigue COVID. Y qué va a ser diferente ahora sin ese enfoque. Y como dice la doctora, que es muy importante, de tantos años ahorita que ya llevamos 3 años en la noticia, mucho enfoque en la alta presión, los riesgos de salud, you know, cómo va a ser impactado por el COVID. Y ahora tal vez ya no tanto, pero esos riesgos siguen para nosotros y siguen impactando en nuestra vida. Entonces hay que seguir nosotros, cada individuo enfocados en nuestra salud y poniendo atención en lo que estamos en nuestras costumbres diarias en la familia. Y como habíamos dicho antes, la cita regular con nuestro médico para checar cómo vamos, ¿verdad? Que cómo vamos ya después de tanto tiempo enfocados con mucho estrés, cómo va el cuerpo.
Exacto, y también quiero decir que también es importante hablar sobre su salud con su familia, hablar sobre ir al doctor, diles a sus hijos que va a ser el doctor y de qué hablaron y cuáles estudios o análisis quiere hacer su doctor, qué te preocupa a usted sobre su salud, hacer esa conversación abierta y honesta para que sus hijos puedan crecer sabiendo que la salud de la familia es una prioridad. So just
Sí.
having that open conversation, I urge families to just have open and honest conversations. You know, you went to the doctor. What did you talk about? What is the doctor ordering? What are you concerned about with your health? That way you raise the next population, the next generation, sorry, to understand that health is a priority. right? Because if it's not talked about at home, then they're going to associate it with not being a priority.
Right, right. Yeah, and I think the most simple things, especially that, the decisions we make as a family of the meals we eat, the
Right.
amount of vegetables and fruit that we consume, because let's face it, we're still a fast food nation, and we're still, we're on the go and making decisions that probably aren't quite healthy. And most of us don't grow our own fruits and vegetables, and
Right.
get to experience that connection with the earth. And so we're kind of separated from the importance of it, la importancia de los vegetales y la fruta en nuestra dieta diaria. Muchos de nosotros todavía andamos muy apurados comiendo comida preparada fácil, pero entonces no estamos consumiendo la nutrición necesaria para el cuerpo. So seguro, esos son decisiones que la familia puede y debe de tomar, tener esas conversaciones en su familia.
Ya, y lo más pronto que empiezas estas conversaciones, lo más fácil que todo va a ser, y también más saludable que va a ser sus hijos cuando crezcan. So just like the sooner you start it, the easier it's going to be, right? If you start early on having a conversation about why you're picking a protein, why you're picking a vegetable, and why your dessert is small compared to your protein and vegetable servings, it's going to make it easier when you have a picky toddler who doesn't want to eat anything, right? Maybe you've already set that expectation, if you will. Or it's going to be easier when you send your kid off to college, right? You don't want them to learn that all my nutrition can be bought at a drive-through window.
Right. One of the things that concerned me, like my mom radar was like on full overdrive when I was having this conversation with the teenagers the other day at the high school, how many of the kids were not eating, because this was during cafeteria lunch times. And so I would look around, and I would say at least half of the kids in that cafeteria were not eating. And when I asked them, where's your lunch? Are you not going to eat? No, we don't eat lunch, or we don't like the food, or, different reasons. Right.
Right.
But the fact that they're going through that long stretch of a day, and not eating anything, I mean, and how that affects their mental state and their concentration, not to mention so I was very concerned about that. I was like, and I think parents of teenagers, we all just assume, oh, surely they're going to eat, right? Like, or I gave them lunch money, or I gave them, sent a snack with them or whatever. But we still have to be mindful that they may not be making good choices outside.
Right. And working to curate that healthy relationship with food, which I know is difficult. And, saying that about half the students not eating, it makes me wonder how many of them are restricting food for appearances, right? How many of them are thinking about their body image?
Yes.
Which is difficult, right? Because you can work really hard in your household to create a body positive family, and to create a healthy relationship with food. But then your child goes on Instagram or TikTok and gets completely different information, which is very difficult, right?
Yes.
But having those open conversations about, your body image and how do you feel about that, and I think people would be surprised how many teenagers will answer you honestly if you just ask. But it takes asking, right? And so how many adults are asking, why aren't you eating? Which kudos to you for noticing, right? I mean, how many people would just walk through there and be like, not even care that
I felt like if I had a tray of food, I'd have been
you'd be like, you have to eat.
That's right. I was just like, oh, no. But you're right. And I was thinking back, back in the 80s in my high school time, I mean, we lived for lunch. Like everybody was starving, regardless of how bad the food was. Like everybody just needed to eat. And so there were very few kids that you would see in a cafeteria not eating. So it really startled me to see that amount of kids not eating. And you're right. There's other influences now that are impacting decisions on food and nourishment for our young people that we may not realize, how.
Yes. And I think we'd be surprised how early it can start. I saw a study, I can't recall when it was done, but it was not too long ago, that said that there is a startling amount of even third grade girls who on a survey wish they were skinnier.
Hmm.
And that's like, think about how young that is, that
Right.
we already have little 10-year-old girls wanting to be skinnier or, to change their body image. So keeping that in mind, as we try to build this community that is health conscious, is being able to identify these things, right? So noticing that somebody is skipping meals, noticing that somebody is playing with their food more than they are actually eating it,
Right.
you
Right.
know, or obsessing over what they're wearing or choosing to wear baggier clothes, and just asking these questions, do you feel like you're obsessed with your body image? Does your life revolve around what you're eating? Do you always think about how you're eating or what you're eating? Do you restrict what you're eating, or do you eat a lot and then you go work out? Um, and it's okay if you don't get the answer from the teenager or the child right away. Being somebody who cares and asking those questions is going to teach them that when they don't feel good, they can go to you for help.
Right. Right. No, and I think, getting back to what we were saying earlier about the role of women in our culture and in the connection. And I had a wonderful visit and meeting an indigenous woman in New Mexico, and we spoke for hours about the culture, the traditions, and the generational concerns from the elders to the young generations. And I was just struck by, these rituals are so much more than just traditions or rituals. They really are based on, sustaining life and sustaining connection. And
Right.
the time that we use to prepare the food or to, learn about our customs from one generation to another, the time that we encourage children to help us in the kitchen prepare a meal, or to go to the farmer's market and have it be an experience that's more than just shopping, right? That is
Right.
I mean, I think getting back to those very almost primitive pieces of our life, so that we are instilling in our young people, you know, that it's not just about trying to force feed them, right, to eat,
Right.
and that when they do see these images coming so fast and, furious, to them, for them to be able to put it more in perspective, to have a bigger picture of
Right.
themselves and and how we are as a family, connect and operate. So, yeah, I mean, I really hope that, I mean, I know for me personally and for our council, those are the pieces that we've pulled from these years of working with the pandemic and in communities, that we want to find ways to reconnect them, with our
Right.
families.
No,
Um,
and you guys are doing a wonderful job at that. And I think it is so essential, especially in the location that we're at. I mean, how many, say we go back to the young couples, right? How many young couples left their family behind, right? And are starting over and don't have that community and have lost that connection, right? Or how many people lost their elders to COVID,
yes, yes.
right? And so what y'all are doing, I think it goes beyond mental health and it goes beyond physical health, and it's life-saving what you're doing in so many different ways. And you're right, these connections, they are wealth for the generations, you
Yes,
know.
estábamos hablando que en observar a los chamacos en las escuelas, que he pasado tiempo con ellos, pero la cantidad de jóvenes que no están comiendo, no están almorzando durante el día en la escuela. O sea, pasan todo el día sin comer, llegan a la casa con hambre, pero ya han tenido el impacto, ¿verdad? Físico de no haber comido. Y las razones son varias. Y como dice la doctora, puede ser algo psicológico del impacto de lo que están viendo en la red social, ¿verdad? Tocante la imagen del cuerpo ideal. y que muchos de nuestras jóvenes hijos, los niños igual que las niñas, son impactados por estas imágenes. Entonces, eso puede ser lo que está impactando sus decisiones de cómo miran la comida, la nutrición, y que deberemos estar vigilando estos cambios en nuestros hijos y buscando maneras de tener esa conexión con ellos tocante la comida, la preparación de la comida, la tradición de la comida, la importancia que no solamente es que queremos forzarlos que coman, pero que es algo más grande, ¿verdad? Es algo tocante de nuestro ser, nuestro bienestar. Y sí, volviendo a estas tradiciones que tienen miles de años, ¿verdad? De enseñanzas muy, muy básicas del bienestar, no solamente del individuo, pero de la comunidad. Seguro que sí. ¿Algún otro punto, doctora, antes de cerrar nuestra sesión de plática? Porque siempre cuando nos ponemos a platicar hay tanto, ¿verdad? Tanto de cubrir porque sí, usted está tomando el papel de doctora, de consejera, de maestra, o sea, muchos papeles que ha tomado usted en la comunidad. ¿Algún otro punto que no hemos platicado?
Antes de ir, quiero decir que este verano es el tiempo perfecto para traer toda la familia para su examen de bienestar. Los niños están en vacaciones, tienes tiempo para venir. Deberemos hacer los exámenes de sus hijos, las vacunas, hablar sobre su salud mental. Podemos hacer todo eso en una cita. Lo podemos hacer. Y si hay algo más que quieres hablar sobre, podemos hacer otra cita, pero hay tanto que podemos hacer. Y ya que tienen ese tiempo, este verano, es tiempo para enfocar en su salud. So just take the time, the kids are off on vacation. Take the time to bring everyone in for their well child visits, your annual exam, dad's annual exam, everyone. Just get a clean bill of health would be a great way to start the new year.
That's
The
a
new
good
academic year.
Right. That's a good point. And right now with some of the changes to Medicare, Medicaid, from the pandemic declaration
Right.
crisis, people need to be mindful to make sure that they are re-enrolling and they're connecting with their
Right.
coverage. And they could come even to the clinic, right? Like Lone Star Family Health Center, if they were patients there, to kind of revisit anything that they need to update, that sort of thing, to make sure that there's continuity in their coverage. Porque sí está cambiando ahorita la declaración de crisis que estuvimos del gobierno estos años. Entonces, para muchas personas que no han tenido que inscribirse cada año en su cubrimiento de Medicare o Medicaid, este año ya va a cambiar. Vamos a volver al sistema donde tienen que inscribirse cada año. Entonces, es muy importante que no pierdan ese cubrimiento. Entonces, pueden ir a la clínica del Lone Star Family Health Center si son pacientes ahí para que les revisen que todo esté en orden, o pueden dirigirlos a cuáles pasos tener que tomar, ¿verdad? Yeah. So it's a good time to get everything organized, regrouped, and focused even more heavily on our health, and really see it not only just as a medical process, but as a community, as a lifestyle process that we've learned so much through this pandemic that can help us and get through the mental health piece. It's understanding that we've all struggled. We've all had challenges these years.
Yes.
Todos hemos tenido retos estos años y está bien. Hay que tener paciencia y tener fe. Poco a poco ahí vamos, mejorando cada día.
Exactly.
Bueno, doctora, le agradezco mucho de todo corazón, como siempre. Me encanta platicar con usted. A ver cuándo nos vamos a tomar un cafecito para platicar un poco más de todo lo que hemos aprendido. Pero verdaderamente usted ha sido una bendición en las comunidades del área de Conroe para nosotros. Saber que está usted allí y que está enseñando a nuestras familias cómo cuidarse mejor. Y esa atención es una bendición. Muchísimas gracias.
Gracias a usted y gracias por tenerme.
Seguro. Bueno, we will see y'all next time. Thank you, Dr. Cruz, and blessings to
You're
everybody.
welcome.
Remember, get your healthy summer going and enjoy it, and you know, just love and have patience. So thank you,
Exactly.
Dr. Cruz.
Thank you.